My name is Willem Proesmans. I spent my whole professional life at the University Hospital of Leuven, Leuven if you prefer, in Belgium. I belong indeed to the first generation of full-time pediatric nephrologists working in a university setting. The first question is, what were the conditions like at the start of my career? During my 3 years of training in pediatrics, 1964 to 67, infectious diseases were core business. Uropathies were handled by urologists for adults, and kidney disorders in children were considered exceptional. The head of my department felt that nephrotics were easily treated with steroids, that acute glomerulonephritis cured itself by bed rest, and HUS was a life-threatening disorder for which no treatment was available, besides transfusions. And indeed, in that 3 years period, 12 patients were diagnosed with Moscovich disease, the old term for HUS, and I assisted at the autopsy of 9 patients. There was no experience with any form of dialysis, but adolescents could be treated with HD in the adult department. To treat hypertension, reserpine and hydralazine were available with little or no effect in hypertensive crisis. The second question, who was your inspiration? The inspiration came from the patients in the first place. Children with K-cut, anti-renal function, spent months in the hospital with recurrent fever, electrolyte disturbances, and dehydration or fluid overload. And also my experience with HUS, as already mentioned, was both appalling and appealing. Professor Denis, the chief of the department, suggested me to concentrate on patients with kidney diseases. A mission impossible at first sight for me, until I read the first textbook on pediatric nephrology, the famous 1963 edition of Problèmes actuels de nephrologie infantile by Royer, Habib and Mathieu. A 500 pages thick Bible-like book with an amazing amount of many clinical and pathology features. It was obvious. Paris was the mecca of pediatric nephrology, and I had to go there. In spite of different hurdles, I spent 2 years in the Hôpital des Enfants Malades, where Pierre Royer and René Habib were teaching us in a most exciting way. By the way, when I arrived, the young Michel Boyer just started as a consultant. At the same moment, 1967, the ESPN was founded. But as a beginner, I was not invited at the first meeting in Glasgow. Anyhow, my stay in Paris was extremely productive. In August 1969, I got my appointment as a full-time pediatric nephrologist in Leuven. In December of that same year, I went to the third ESPN meeting in Helsinki. At home, PD was applied successfully, and HUS patients survived almost at 100%. 7 years later, I went to the United States, attending the annual seminar of pediatric nephrology in Miami, organized by Jose Strauss, and thereafter I flew to Seattle, where I spent a week with Bob Hickman, who had some patients in chronic dialysis at home, which was an amazing novelty. And finally, I went to Los Angeles to visit Richard Svine's department of pediatric nephrology, with a huge hemodialysis unit run by an enthusiastic, devoted, and highly professional team. Third question, how did the treatment change in my career? Well, the most important advances undoubtedly were dialysis and renal transplantation. The industry provided better and better equipment for HD and PD, adapted to children and infants. Moreover, the pharmaceutical industry developed more efficient antibiotics, antihypertensive drugs, and immunosuppressive therapies. In our unit, chronic hemodialysis was started in 1976, just after my stay in the United States, and the first renal transplant was carried out in 1980. For vascular access, we used external shunts at the very beginning, which somewhat later was replaced by subcutaneous fistula. But I should not forget to mention the magnificent acquisition of recombinant human growth hormone for the treatment of children with CRF, of recombinant erythropoietin, and 1,25-dihydroxyvitamin D. Next question. Tell me about your discovery or new treatment. In terms of discoveries, I consider my main contribution to pediatric nephrology the study of amniotic fluid and the urine of the early days after birth in babies with the most severe form of neonatal Bartter syndrome, accompanied by polyhydramnios and prematurity. We were able to show that the amniotic fluid had normal concentration of prostaglandins and potassium. The urine of the first days of life had normal prostaglandins as well, and was characterized by a tremendous loss of sodium chloride, which gradually was replaced by potassium loss, leading to hypokalemic alkalosis after 3 to 5 weeks. These findings enable prenatal diagnosis of Bartter disease. Moreover, with appropriate fluid and electrolyte replacement, the increased production of prostaglandins could be prevented. In terms of treatment, we were able to show that recombinant human growth hormone treatment in children with CRF not only resulted in acceleration of growth in body length and weight, as many have shown before us, but also to an improvement of bone density and the head circumference. I also had the privilege to study a cohort of 20 patients with chronic renal failure from birth until the age of 3. Conservative treatment without tube feeding, without growth hormone, was found to be very efficient, as growth was within the normal limits with only subtle signs of renal osteodystrophy. I devoted myself to the conservative treatment of chronic renal failure not only in infants, but also in children and adolescents. By using an ACE inhibitor, in addition to a reasonable protein restriction and moderate supplements of calcium vitamin D, we showed that the progression of renal disease can be slowed down, so that it may be possible in a great number of these patients to postpone dialysis transplantation to a later day. Last but not least, I'm proud to remind that I insisted to publish the findings of one of my very early patients with the combination of a Willem's tumor, genital ambiguity, and the nephrotic syndrome. This was the very first description of what is known now as the Denis-Dresch syndrome, Pierre Denis being my first boss. What is my advice to the next generation? I would like to say that pediatric nephrology is a fantastic specialty, because today there is a solution for almost every disorder or problem. Yet, in the last period of my professional life, I had concerns about the poor quality of life for pediatric patients during chronic dialysis. I had even stronger concerns about the relatively poor results of transplantation, since most transplanted children actually develop chronic renal failure again, relatively soon after transplantation. Moreover, I had been shocked by several types of excessive and aggressive application of these procedures. I'm referring to sometimes unnecessary bilateral nephrectomy. I'm referring to too early initiation of dialysis. I'm referring to some cases of an unjustified transplantation. Therefore, I think we should put more energy in the conservative treatment of children with chronic renal failure in order to postpone dialysis and transplantation, for the simple reason that the complications of both procedures are much higher than under conservative measures. Unfortunate children with severe kidney disorder should not suffer more than is needed. My dream, therefore, would be that in the years to come, only a few exceptional pediatric patients would need chronic dialysis and/or kidney transplantation. Because if postponed to adulthood, a better outcome of both procedures is obvious. Asked to say a few words about the ESPN, my experience with the ESPN. My first contact with the ESPN was the Helsinki meeting in 1969, and for the following 20 years, I missed only one meeting. In the first period of roughly 5 years, ESPN was a nice, get-acquainted meeting place with the pioneers, most of them university professors with some experience in some aspects of kidney disease. Indeed, most of them had a broader field of interest and activity. So the yield of the meetings was friendship rather than science. But in addition, for the non-English speaking attendees, there was the opportunity to become familiar with the English terminology and speech in an overall cozy atmosphere. In the second period, the arrival of a second generation of young full-time pediatric nephologists provided the necessary added value of scientific ideas and findings. These new members came from all over Western Europe, the big countries like France, Germany and the UK being represented by several members of the kind. The British colleagues, of course, did most of the talking, but in the meantime, by virtue of their inborn politeness, they set a tone for kind and constructive contacts and discussions. The French colleagues suffered somewhat from a linguistic handicap, but René Habib fully compensated for this. The Germans displayed the most pronounced effort to set up multi-center studies. Unfortunately, for a very, very long time, only retrospective observations and studies and case reports were presented, and it took several decades before attempts were made to carry out prospective studies. 3 RCT studies on the HUS emerged and deserve mentioning. In Leuven, we studied the effect of heparin, while in Paris, Chantal Loira used urokinase, and in Padova, Gianfranco Rizzoni looked at the effect of fresh frozen plasma. It is fair to say the impetus did not come from the ESPN. Meanwhile, the society was growing almost exponentially thanks to, among others, the inclusion of Eastern European pediatric nephrologists. And in this respect, I would like to pay tribute to Ernst Leuven from Zurich for having, so to speak, forced the Iron Curtain to invite and arrange to attend pediatricians from Yugoslavia, Poland, Czechoslovakia, Russia, etc., an obvious blessing for them. In summary, the ESPN was a genuine European forum with the following merits for me and I guess for many of my age. A touchstone for the own clinical and scientific work, a kind of oral peer review and face-to-face. Getting insight in what others were doing in a given field, providing ideas to keep pace with the international tendencies, and inspirations for alternatives in terms of investigation and treatment. The ESPN has been a success story, and 50 years after its foundation, I think that it remains a wonderful, indispensable society.